The Centers for Disease Control and Prevention released some new guidelines about Halloween. Experts recommend no trick-or-treating, no indoor costume parties, and no haunted houses because they are all high-risk activities. Dr. Maria Simbra takes a look at what you and your family can do and still stay safe. New at 6.
This time of year, lots of people plan for trick-or-treating, but the CDC advises caution.
Our whole year has been different. Why should Halloween be any different?
The government public health agency lists traditional Halloween activities by high, moderate, and low risk.
But I think there are ways to do some of the fun stuff safely.
High risk includes indoor costume parties, haunted houses, hay rides, and alcohol and drugs, which could cloud judgment.
It is dangerous to be inside in large groups, especially if you're yelling or singing or screaming.
And door-to-door trick-or-treating, that's high risk too.
I think what we're not going to see, or we should not be seeing this year, is the 10 kids clustered around your big bowl, all diving in to get the big candy bar. That is where people spread germs.
Moderate risk, costume parades, outdoor movie nights if people are screaming, and the beloved pumpkin patch excursions.
You've got kids, clustering around the big pumpkins to pick one out, and that's where you're going to get transmission.
Even grab-and-go goodie bags.
If you really want to hand out goodies, then putting them in baggies at the end of your driveway or at a safe place that's distant where trick-or-treaters can come up one at a time and get them, that's a way to do a really fun traditional activity in a more safe way.
Activities of low risk include carving pumpkins, decorating your home, and scary movie night with just your family. The recommendations come at a time the CDC has had some credibility problems.
I think that every time they come out with something new, there's part of the population, professional and lay, who kind of go, really?
But even for Halloween, the advice is consistent.
Don't get close to people, especially in indoor spots. If you have to be close to somebody, keep it outside and wear a mask.
Costume masks, especially with holes for the nose and eyes, are not a substitute for a double-layer fabric mask that covers the nose, mouth, and lower face. Also, the CDC does not recommend that fabric masks and costume masks be worn together. I'm Dr. Maria Simbra, KDKA News.